who's next.
Hey, how y'all doing? Back again on another episode of the It Factor Podcast. As always, I'm your host, Jeremy Robinson. And today we have someone special. Go ahead and introduce yourself.
Hello, Jeremy, and thank you for having me on the IT podcast today. My name is Dr. Madeline Sutton. I'm a board certified OBGYN, medical epidemiologist, which just means that I like research and all that stuff. A part-time faculty member at Morehouse School of Medicine, a mom of three wonderful sons, an author, and an international speaker, best-selling author and international speaker.
All
So
right.
thank you for having me today.
All right, now. So it's a pleasure to have you. I say, how are you doing mentally, physically, and emotionally?
I'm doing okay, Jeremy. Like many people in the country right now, I think it's been a rough couple of weeks. But I think that, as long as we all continue to pour into ourselves and, find moments of joy, I'm really serious about finding moments of joy. I try to inspire and encourage all of my patients and family members, everybody to find moments of joy.
Right.
So I'm okay today. Thank you for asking. How are you doing?
I'm doing good. I got my workout in. Work went good today. It's Monday. I
Okay.
had to realize it was Monday. But no,
Yeah.
it was good. Every day a good day. That's something I've been living on. Every day's a good day. No matter what's going on. Try to get some
Good.
peace out of
Good.
it, because you never know. So
Yep.
try to
Yep.
always try to have a good day. So I say, what's
Okay.
your it factor? Why do you do what you do?
Do what I do. I am passionate about women's health. I mean, I love taking care of women, especially women or people who look like me.
Mhm.
I'm from a part of New York City, Harlem, New York City, that, growing up, it's considered one of the underserved neighborhoods, in New York City and in the country, really. It's a neighborhood that is predominantly Black and brown. And growing up, I could see that healthcare was approached a little bit differently. Just my primary care visits may have taken place in the emergency room more often than in a doctor's office. And when I was 18 and getting ready to go away to college, I had to have, back then, we had to have a mandatory pelvic exam, believe it or not. Like all girls leaving for college had to have a pelvic exam. And something about that experience changed me in terms of it was this white male physician who just kind of walked into the room, no introduction, no words really, and it was the a couple of Black nurses in the room who introduced him. Like he never really said much, and they were just like they were giving me all the instructions, and I was like, something is wrong with this picture, in terms of how to communicate with folks, how to make sure people feel comfortable. In healthcare, we meet people during some very vulnerable moments. And so I think it's really important to try to connect to people, try to help make sure that anyone that you're caring for has your compassion, your attention,
Mhm.
so that they can not only feel heard, but feel that they are supported in whatever it is that they need to do. The other part of what I do in terms of like advocating for STEM education and career with mostly Black and brown young people. That's the other part of what I do. And I'm passionate about that because I feel like as a little girl growing up in Harlem, that there were people who I think inspired me. And
Mhm.
so it's really something I find important to try to be that inspiration to little kids who are in different communities now so that they can see that they too can be and do whatever they want to do.
Indeed, I love that. I love that. I can see you doing that. I mean, even when I was like researching you and looking at some of the questions to put together, I was like, I know it's always be conversational with my show, but I was sitting there like, she has done a lot, man, and that's good for the Black community. Like, I love that. I work at Spelman
Thank
College
you.
myself. I went to Clark Atlanta University, so seeing
Okay.
that you work at Morehouse School of Medicine, my cousin having a frat brother that graduated from Morehouse School of Medicine. I just want to commend you
Okay.
for what you're doing, and you're working in the medical field for so
Oh,
long, and I know you have impacted so many people that look like me and you. So just thankful for that. Just definitely thankful.
thank you. Thank you. And thank you. I think, your platform is really important. Anytime people can hear different voices or, have you bring attention to different topics and subjects, I think that's really important. And I love your t-shirt, Choose Therapy.
Thank you. Yes, indeed. I got to my
Therapy is
friend.
such an,
It's my
what'd you
friend.
say?
It's my friend. Choose therapy. It's my friend.
Okay. Okay. Yeah, that's awesome. I think, I think we're as Black and Brown communities understanding the importance of it more and more. But I think there's always room for more therapy, more self-awareness and understanding to make sure we have the tools that we need to kind of navigate through a lot of the external forces and stuff.
You definitely right about that. And the crazy thing I've been noticing is a lot of people that I interview need to be athletes, need to be like people you would never think was going to talk about mental health. They'll go and say, that's something I want to touch on or something I want to talk about. I'm like, okay, I got an interview next week with an athlete. He was like, man, I seen the question. They real good, bro. Like, but I was wondering, can we talk about mental health? I said, of course we can.
Right.
Of course, of course we can, man. Of course we can. So I was
Yes.
definitely. I would say though, my next question is, so with you being an OBGYN, working at Morehouse School of Medicine and also having your own business, how have you inspired and improved uh, the health system at each stage? Or how have you worked to say, I'm gonna improve this each stage?
That's a great question, Jeremy. So one of the things that I realized early in my career is not only do I love direct patient care and taking care of people, but I also love research. I love collecting data, and I
Mhm.
love doing it in a way that can try to inform policy. And so the way I tried to merge all those things together is after residency, I finished my OBGYN residency. And I decided to work at the Centers for Disease Control and Prevention, or CDC.
Uh-huh.
And so I finished residency. I was accepted into a program at CDC that was a 2-year fellowship training to
Mhm.
learn about epidemiology and hands-on applied public health. And I did that for 2 years. And, fast forward to today, I stayed at CDC over 20 years doing research all related to sexual health and wellness and HIV prevention and STD prevention because I really wanted to inform data, inform studies that could be used to inform policy. Because it's all about the policy. How do we get things to be written into law in a
Mhm.
way that helps those populations that we think might need, an extra bit of health care to kind of balance out and close some of the gaps with health equity.
Indeed, indeed, and you're doing that because I mean, some of the things you touched on, I feel like even when you said when you started, like when we started the interview, you were saying that you noticed that oh dang, this ain't right, or like the doctor was doing this, you're like, wait, we got to change that. So I would say, was that a reason why you say, you know what, I got to be in the medical field because I got to be something to be a person to be able to change what's going on here, and see the bigger.
Yes, yes, that was definitely one of the things that motivated me. I wrote a children's book
Uh-huh.
recently, and one of the other things I talk about that motivated me was this chance interaction I had when I was about 12 or 13.
Mhm.
Um, my appendix had to be removed, and I just happened to meet this doctor who was just very kind.
Mhm.
Sometimes people don't really fully understand how a little bit of kindness can go such a long way. And all he did was the day after my surgery, he came back into my room and he was just, telling me what happened and showing me my scar. And he brought in a little plastic cup my appendix that they had taken out that day before.
Uh-huh.
And it just like it triggered a light bulb in me. I was like, oh my goodness, what he did as a surgeon, I thought was one of the coolest things ever.
Yeah.
So so yes, that was another motivation, like really loving science, wanting to understand the body,
Mhm.
thinking about the fact that we can, as surgeons, um, remove something from someone's body that's causing them discomfort or pain, and then you can put them back together and they heal and they're able to heal and do okay. That was exciting to me. Seeing the health equity issues and challenges that were going on, and not just my neighborhood, but neighborhoods all across the country, across the globe. That was another motivation for me. At CDC, most of my career was spent doing HIV prevention and STI prevention research. I was coming up at the time when HIV and AIDS were first identified in the early 80s. And so it just kind of it triggered in me this desire to want to learn as much as I could, understand more about it, help people who were living with it and or not living with it, understand the risk factors that were involved, understand ways that we could work as a group to try to reduce the exposure, Um, and also for those that were living with HIV to help do work and research and implement policies that can help them live the healthiest and best lives possible. So those were my main motivations.
I got you. I got you. So I would say, who is Dr. Madeline outside of being a physician, outside of being a professor? Who are you? Outside of being a mother, outside of being the multiple things that you are, who are you?
Um, you know, that's a great question. So much of who I am is poured into the roles that I have, the
Mhm.
hats that I wear. So yes, Madeline, the OBGYN, the surgical subspecialist, the mom, the author. Um, Let me show you this because I'm
Yes, ma'am.
of the things that I am, this is one of the things I'm proud of. I'm
I'm a
a
two-time
children's book
author
author.
myself. I love being an author. I tell you,
Isn't that great?
it's so
Yes, because
it's so amazing. It's gonna be here forever, and it's the impact that I've
yes.
seen so many young people and even older people that's just like, you wrote books, you wrote yes. And they
Right, right. And and so I'm sure you understand we write these books to try to inspire, try to inform. So I'm also that. I'm also an author. I am also someone who is adamant and extremely passionate about self-love and self-care.
yeah.
I honestly think that no matter what hats we wear, if we don't love ourselves intensely,
Mhm.
if we don't honor ourselves every single day, no matter what decisions we might have to make, if we don't do that, I think that we start at a deficit.
Yeah.
And so, who is Madeline? I am a passionate self-care, self-love advocate because I honestly think that the more we can do that, the
Mhm.
more we can heal ourselves and be better people for all the other hats that we have to wear. One of the other reasons I'm passionate about it is because not only in my own experiences as a mom, a former wife and all that stuff, but seeing my patients and talking to patients in clinical settings and in some non-clinical settings, but just hearing their stories, seeing how they're trying to juggle all these things and be all these things to all these people. And I'm like, girl, you got to, they say it all the time on the plane, but to actually live that, to live putting your oxygen mask on first is a really, really difficult thing,
Gotta take care of
especially for a lot of women and people who are moms and parents, dads, especially when you're caregiving for
you.
other people. But if we don't do that, if we don't breathe our own oxygen first and then hand off the mask to other people, we are just not yet at the 100% that we need to ideally be at to best take care of ourselves and of others.
Yeah, I love that analogy. That's true. That definitely. You gotta take care of you, man. Got to.
Absolutely.
It's the only way you can be the best for other people. So definitely, you're right about that. And I would say, what are some of the biggest challenges in the healthcare today, and how do you think we can work towards like meaningful change? Because I know a lot of things are happening in the healthcare field. We ain't even got to talk about all, but it's a lot of things, and it's like it's
Yeah.
fearful. It's kind of fearful because it's like, what the world? Like, I can't believe it. So
Yeah, no, there's definitely a lot of things happening in healthcare right now, whether, you know, you look at it from like a, a health care access point of view in terms of can people get in to get the care that they need, whether that's if there are enough facilities in their neighborhoods or whether it's what type of health insurance they have or don't have. In women's health, we talk a lot about maternal care deserts. And that really is just highlighting the fact that there are a lot of counties in this country, even here specifically in Georgia, more than half of our counties don't have any obstetrical care that's local to where the birthing person might be. So there are places where people either make a decision to skip care or they have to drive over an hour, sometimes 2 hours to get to care, especially if they have a high risk obstetrical history. And, more and more, we have to be willing to understand the different things that are going on and partner with other people who can be a part of a care team. If you're talking about birthing people, definitely you want to make sure we're partnering with like midwives and doulas and all of that. But then when you think about the bigger picture, and this goes back to what I was saying earlier about research and data and policy, if we are simultaneously encouraging more women to, or more people, birthing people to get pregnant, but then stripping back some of the access and reproductive health rights and different things that they need access to be able to be their healthiest selves, then we're really setting up like this perfect storm.
Yeah,
As a women's healthcare provider, I'm definitely passionate about women and other birthing people being able to have access to everything they need to make the best decision for themselves. No one should have an impact on that decision except, do you have the information that you need? Um, how do we get you that information in a way that is without bias so that you can have information that is as clean as possible so you can make the best decision for you? And then how do we support you to the healthiest outcome once you make the decision that is best for you and your family? So yeah, these are challenging times. You ain't said nothing but a word. It's
look, I totally agree. That's why I had to ask it. I was like, well, because there's a lot of things happening, and I was like,
it's a,
"What?"
a lot of stuff happening. Yes.
But we're gonna overcome, man. There's things that's gonna happen. I feel like we're gonna be fine. We'll be fine. There's a lot of
I
things.
hope so.
I hope so.
I hope so. I hope so. There's a lot of work that we have to continue to do.
Mhm.
Um, Outside of the policy, what local things are going on that we can help facilitate? What local elections are happening with people who are on the side of health access and access to fair and equitable care? Who are those people? And let's make sure that their voices are part of the conversation as well. So yes, there's a lot that we need to do, and that I'm excited to be able to continue to do
Indeed,
to
indeed.
make to make sure that women have the care that they need.
Yes, indeed. You're right about that. So I
Mhm.
would say I only have a few more questions. I would say, when it's all said and done, what would you like to be remembered for?
Ooh, I would like to be remembered as someone who was very intentional
Mhm.
about trying to live her best life, whether that's me doing self-care, whether that's me being the best mom I can possibly be, whether that's me being the best partner I can possibly be, the best physician, the best researcher, the best scientist. I would want to be remembered as someone who left it all on the court. I joke with my sons sometime. I say to them, when it's my time and y'all are trying to figure out, what all to prepare for me,
Mhm.
if there's a headstone or whatever, put on there, mom left it all on the court.
There you go. Yes,
You
indeed.
know?
Indeed. I love that. I love that. I love that. I would say, how did you stay motivated? You had to go to school for a good little while now. You had the undergrad to going to medical school to going through clinicals, going through the different things. I interviewed my good people, so I know a good little bit how the process go. And went to school with some people that have finished. And I'm like, I'm proud of you, but you was in school for a long time. So like,
Yeah.
how did you stay motivated? And what made you say, what, I got to finish this?
Mhm. I For me, it was really important to make sure I was enjoying every step of the process.
Mhm.
So, and I tell young people this all the time because they'll say, "Oh, that's so many years." Okay, but it's a lot of years, but you're working on something at each part of the process. So yes, when you start at the undergrad level, I was very fortunate. I went to an undergrad institution, Georgetown University, where I absolutely adored everything about it. I loved not only the subject that I was learning, but I loved the environment of people I was around. You
Mhm.
know, um, to this day, I'm really close with my classmates, people who I went to school with, who I met in, 1980s and, still keep in touch with them in 2025, you
Yeah.
know. So that's a really important part of it. Going someplace where you can feel your passion like every single day that you're there. And I know that doesn't happen always for different people, but I've had some friends, maybe they didn't stay at Georgetown, maybe they left and went somewhere else and their passions were still able to be realized somewhere else. So I would say identify your passion and continue to chase it at every step, whether it's in academics, whether it's in social life. Sometimes people look at what we go through as physicians, all this schooling and all this stuff. You can still be a party animal.
Indeed.
I went to my parties. I went to college in DC. We have a lot of parties. DC is a big college town. So, I made sure that I had a balanced approach to everything. Um, that was really important to me. Medical school, same thing. I'm from Harlem, New York. Like I was saying earlier, I was fortunate enough, blessed enough to be able to go to Columbia Med School, which is literally walking distance from where I grew up. And that was important to me too. Doing something as hard as medical school, because I'm not gonna lie, med school was one of the hardest things I've ever had to do.
Mhm.
It was a hard 4 years. I got through it. I loved every part that I was learning.
Mhm.
But when you're going through something that hard, it is absolutely important to make sure you can have those moments, those outlets when you're like releasing steam, when you're recentering yourself, when you are, dancing the night away at a club because you just got through a rough week of exams.
Right.
You know what I mean? When you're not too far from your family so
Mhm.
that you can make sure you get over there for Thanksgiving dinner and see and love on all your people and your cousins and your aunties and uncles and so all that is a really important part at each phase that you go through. Same for residency. I chose a residency program. I was able to go to a residency program where the patient population I was caring for was really important to me. It was also important to me that I had other Black and Brown co-residents who were there and working as part of the training that I was in when I was doing my OBGYN residency. So all of those things help to allow you to keep your eyes on the prize and understand that as long as you can continue tapping into that passion, you will get through even the hardest days. Now, me tapping into passion doesn't mean I didn't have days where I wasn't in tears, where I
Right.
didn't want to quit. I absolutely had those days. But I was fortunate and blessed enough that I was always able to tap into the passion, the thing that was driving me to that goal. And it was always okay.
Look at you now. I say, do you have any questions for me?
Jeremy, so tell me about how you decided to do this podcast and started.
Yes, I love telling this story. I get asked it a
Okay.
good number of times. I say that I started a podcast back in 2019. I went to college at Clark Atlanta University and went to Northeastern
Okay.
University of Engineering. And the crazy thing was while I was there, you take some hard courses, some courses that you like, what is this? What am I doing? And I never forget I was going through a class. I think it was some coding class, and I get how to develop and all those things. This is how my brain works. But it was something that wasn't making sense. So I was looking up people, and I was like, I'm at an HBCU, but my teacher ain't black. And I'm like, what? Like that's what I could not get it. And I said, well,
Okay.
I prayed and I said, well, God, if you get me through this class, I'm gonna do something to give back. And my biggest thing was I found myself looking on YouTube, couldn't find nobody to look like me, and I said, that may be it. Kept on going. I graduated. I finished school. I'm done. And it just kept coming back like, hey, when you gonna get back? When you gonna do this? I'm like, I'm doing it. All right, cool. And at some point I realized I was like, and I guess I got company say this now years in that was God the whole time guiding me. Like, hey, I'm giving you all these things and this is happening. I'm the reason why this is happening. And hey, what you gonna do that you said you was gonna do before? And when I came into doing it, I'll tell you the craziest thing is I never looked back. I started the podcast and at first I was gonna bring IT people on because that's what I worked in heavily. But then I talked to my
Right.
mom, my now wife, and we was all sitting there and she was like, athletes, doctors, you need to bring everybody on. Don't discriminate. They famous, they come and they working people. Just don't discriminate because
Hmm.
it's gonna set you apart. And to now interview some of the people that I interview, it's a blessing, and I think
That's
that
awesome.
I love to see people tell their stories and you see like how I interviewed you. I like to just sit back here and be like, they did what? Inspiring. Very inspiring, very inspiring. So yeah,
Thank you. Thank you. I'm inspired by you too. Really great work that you've been doing with your podcast. So congratulations.
thank you so much, and I look forward to collaborating with you again. This will be coming out soon. I'll definitely keep
Okay.
you updated and email you, and
Okay.
I'll talk to you soon.
Okay. Thank you so much, Jeremy. You have a
Thank
good
you.
evening.